All right, Kate. So tell me a little bit about yourself and why you're passionate about falls prevention.
Thank you. Yes, I've been a physical therapist for over 25 years, and my whole entire career has been dedicated to serving the aging adult client. I have been a geriatric clinical specialist, as certified by the American Physical Therapy Association. And my company, Greenfield Rehab Agency, our entire mission is to provide services to aging adults across the entire state of Wisconsin. I'm passionate about falls prevention is because it's so widespread and affects so many aging adults. And usually when there is a fall that's sustained, the cascade of events that follows can often be so troubling that prevention truly is the key. On a personal note, I'm very passionate about this subject. About 4 years ago, my father passed away 1 week after he had a significant fall due to the injuries sustained in the fall. So, if that doesn't make me more passionate about it, I don't know what would.
Yeah, it definitely sounds like it's kind of interrelated in your personal life, your professional life, and you kind of dedicate your work to it, which is really great. Um,
Yes.
so how can physical therapists help older adults reduce the risk of falling?
So, what physical therapists can do is we provide a comprehensive physical evaluation of your body systems. What's your balance like, your strength, your cardiovascular health. We often collaborate with other members of the interdisciplinary teams, like physicians and pharmacists, to review your medications as well to see if there's an opportunity for that to make sure that you aren't increasing your risk for falls for any reason. We often design a customized home exercise program based on our findings that is customized to your particular needs so that we are working on the things that are needed to keep you as independent as possible. And one of the things that physical therapists always do is help people learn how to get off the floor from a fall. Sometime when it's hard to put someone in a position on the floor because it feels very intimidating, but learning techniques to get safely off of the floor if you do fall can really be important.
Yeah, that's something I never would have even thought about once you're on the ground. How do you get up and learning different ways to do that? I think that's really helpful.
Absolutely.
So, what kind of exercises can help older adults reduce the risk of falling, and how often should they be doing those exercises?
So, really, the exercises should be a combination of strengthening, of working on balance reactions, cardiovascular health, and flexibility. So, you really have to look at all those parts in order to make a good comprehensive program. As far as how much, usually, ideally, it's about a 10-minute warm up to get your body moving. And ideally, you'd like 30 days, 30 minutes of activity there. So when you have 30 minutes of activity, you can either do that in 1/2 hour, or you could break it up, say, in 3 10-minute increments. So, and then of course, a cool down is important as well, just to kind of get your body back down to your resting rate. So exercise should involve a little bit of effort. It shouldn't feel just as good as it does sitting at the kitchen table. So there should be some exertion with that. The Center for Disease Control usually recommends, if you could, every day, but a minimum of 5 days a week of getting out there and moving in some way, shape, or form for 30 minutes. And that could be walking or swimming or doing exercises or yoga or riding a bike. Any of those activities that cause your body to exert yourself more than normal are really what they're looking for, an effortful movement that is going to give you the results you're looking for.
Yeah, I like how you said you can do it throughout the day too. It doesn't have to be all 30 minutes all in one shot. If you don't have those 30 minutes, or if you get too tired, maybe even kind of breaking it up throughout the day, I think that's really helpful for people.
Absolutely. And it's important to know that if you would do that consistently, you should be able to see small improvements in almost 2 to 3 weeks. And if you can keep that up in 2 to 3 months, you're going to see significant changes in your mobility.
Mhm.
And once you're doing that consistently, if you stop even for a week, let's say you take a week off and go on vacation, you can lose up to 10% of your progress and your physical abilities in just 1 week. That's why it's so important that we keep it up. And if we have a setback like an illness, starting back over and building up that tolerance is really important.
Yeah, definitely. It can be easy to get started, but also easy to kind of fall off, but definitely important to keep going.
For sure.
If you could tell your patients one thing about the importance of reducing the risk of falling, what would that be?
So a quick and easy way to be like, to see if you do have a risk for falls, sometimes maybe just stand next to an object and try to stand on one foot. Can you stand on one foot for 5 seconds without holding on to something? And if you can do that, you're pretty good. But if you're having trouble or you need to grab something or set that other foot down, that may tell you that you need to consider integrating a program to help strengthen your balance to prevent falls. So really there's four easy things you can do. First of all, looking at your medications with your physician or your pharmacist to see if there is anything that could be causing falls or put you at a higher risk is important. Making sure you're having your vision checked, how are your glasses fitting well, or do you need glasses? Are they at the right prescription so that you can truly see obstacles in front of you or see the foreground, or is there a curb step coming up? Is there a crack in the pavement? Just so you can visually see what's coming up for you. Making sure your home is safe, using different checklists to prevent falls, prevent things that you could trip over, or find more efficient ways to do tasks in your household that minimize the risk for falls. And then finally, seeing a physical therapist to really develop that customized exercise program for you that takes into account your posture, your strength, your flexibility, what your home looks like, what your activity level is, to make sure that you are able to keep where you're at, if not potentially improve and reduce that risk of falling. Something I also always say to my mom is when you have activities, I think there's a difference between practical risk and just silly risk. So, for instance, my 90-year-old grandma, when she was still around, she would go climb a ladder and clean out the eaves on her roof. And my dad would be like, "What are you doing? That is not necessary." And it certainly wasn't. Totally impractical risk. You probably should hire someone for that. But then there's practical risk, going to the store, walking around. That's all accepted things that we can do throughout our day. But assessing, do I do some risky behaviors? Do I do something that before I do it, I think, should I really be doing this? Or could I really sustain a bad fall and an injury from this? Sometimes our bodies don't follow through what we think they're going to do. So, really kind of assessing high risk activities versus practical risk just to curb that incidence of falls as well is also important.
Yeah, I definitely think that's a really good point to make. And your grandma definitely sounds like a dedicated woman and independent, definitely, but knowing the difference and assessing your risk is very important. And like you
Absolutely.
said, physical therapy can definitely help. The exercises can help. And there's a lot of other things that go into falls risk, but also really appreciate you taking the time to kind of explain your role and why you're dedicated and passionate about falls prevention. And we hope that your patients can understand that as well.
Thank you so much. I think this is an awesomely important topic, and we're glad we can help.